chào các bạn. We are Team 3 from I3.2 class. Our topic is of nerves, and in this video we'll talk about the scenario, a short infographic of the nerve examination, conclusion and result of the nerve examination, and then finally breaking the bad news.
First, we'll know the scenario of the patient through taking history, and then the details about the physical examinations, diagnosis, and then the announcement.
Only the doctor wants me, okay? Can we come in? Yes.
Hello, I'm Dr. Navya. Thank you for coming in today. So before we start, I would like to ask you a few questions. Is that okay?
Yes, sure.
Liana, what is your name?
My name is Yayamfo.
Okay. And how old are you now?
I'm 32.
32 years old. Okay. So, wait, before we move on, I'd like to ask you a few more questions. Okay. So, where do you live?
I live in Mayanmanko Street.
What do you do for a living?
I'm a software engineer.
Software engineer. Your name is Yana, you're 32 years old, and you live in Mayanmanko Street.
Yes.
And then you are a software engineer and you're currently single. Okay. May I know what are you here for today?
I've been having really bad headaches again, worse than it was before.
Oh, so when you say again, do you mean that you've had these type of headaches before?
Yes, I have had a seizure and headaches 3 months back, for which I was admitted to a hospital.
Oh, so do you know what exactly is the problem? Like why you had seizures and headaches?
I don't really know, but I was admitted to the hospital and I got treatment and discharged.
Oh, so you felt better after the treatment, but you don't know what it is. Okay. So, when did you start having these headaches again?
About a week ago.
A week ago, okay. Where do you usually feel the pain? Is it like on your forehead, the temples, or back of your head, or is it like overall?
It's usually in the back of my head, but sometimes it's also in my forehead.
And when you get these headaches, so how long do they usually last for?
Sometimes it's just for an hour or two, but lately it's been most of the day.
Okay. So, and then how would you describe the pain? Is it throbbing? Is it sharp? Is it like a dull pain or anything else?
It's usually a dull pain, but when I move my head quickly, it's a sharp pain.
So, is there anything that makes the pain worse?
Yes, bright light makes it worse and noise also. And also when I sometimes bend to pick up something, it hurts.
And then is there anything that makes the pain better?
Yes, sitting in a dark room makes it better.
So do the headaches happen at like certain time of the day? Like, or do they get worse at like certain time of the day?
It's mostly in the morning when I wake up, but also in the afternoons when I'm working.
Or in front of the computer, right?
Yes, I sit in front of the computer.
Okay. So on a scale 1 to 10, 10 being the worst, how would you rate your pain?
Then it's more than that. Sometimes I feel like my head will explode, and also I'll pass out.
I totally understand that. I really wish that on my voice. That sounds really good. I'm so sorry. So, and then I would like to ask you more about your other symptoms other than the headaches and seizures you've had. I want to know about your other symptoms.
I feel numbness in my arms sometimes, and also the left side of my body does not coordinate with my right side.
Now moving on, you mentioned at the beginning that you had a seizure before, right? So can I ask you more questions about it?
Yes.
Yes. Okay. So when was the last time you had a seizure?
It was 3 months back.
3 months back. So can you describe me what happened? Like what happened during the episode?
Sure. So I've been having headaches for a few weeks before that, 3 months back. And one day I suddenly collapsed and my sister told me I was shaking and unresponsive. So I got admitted to the hospital. I stayed for about a few days, a week I think, and I got and I got treatments. And once I got better, I was discharged.
So let me summarize everything once. So you've had headaches before in the past and the seizure 3 months ago, and then you were admitted to a hospital, and then you got treated for it, and then you felt better, but discharged. We don't exactly know what the problem was. And now we started having these headaches again about a week ago. Thank you for being so open. This information is really, really important. So based on what you told me, I would like to run a few tests before I confirm the diagnosis. So yeah, thank you. I will try my best to support you in every way possible. Thank you very much.
And now our patient Yai Yangfo will undergo nerve examination for further diagnosis. These are some of the key components of the neurologic examination and some of the tools that we used to examine the patient. First, we'll check upon the lower and upper limbs of our patient. We have checked the distal and proximal muscles of both upper and lower limb, and also Barre's test and Mingazzini's test to assess the weakness of the limbs. And next we have assessed the patient with MRC scale for paralysis, and then the upper limb, lower limb, superficial and plantar reflexes of the patient were tested. Coming on to the main exam, testing the meningeal irritation, our patient showed positive signs of having meningeal irritation, which means our patient could have meningitis. As per the doctor's advice, our patient had gone through MRI scanning, which showed that she has carcinomatous meningitis.
Hello, are you patient Yai Yangpo's family?
Yes, we are.
Can I please have a talk with you in private?
Yes, sure.
Please follow me. I'm really glad you both came in today. So Leila, before we start, I wanted to ask you, how are you holding up? I know the time has been stressful, so I just wanted to know about your own health and whether there is anything that I should be mindful before we start the talk.
I appreciate you asking, Doctor. I do have a heart condition. It's controlled with meds, but I still get tired easily and I can faint sometimes. I do faint sometimes.
Thank you for sharing. Please feel free to pause if you need a break. We'll take this conversation slowly and gently.
All these three should be carried out one step at a time while delivering the actual diagnosis and breaking the bad news.
She's been stressed this past few weeks. She has not slept properly, especially with all the changes in her sister's condition. I know how hard this has been. You've both shown so much strength and love. Your sister is lucky to have you both looking after her.
I don't feel strong. I keep thinking I should have noticed the signs earlier. She said she was tired, but I just thought it was the part of recovery, man.
That kind of reaction is normal. And symptoms can be vague early on. No one knows or expects anything to be behind them. Please, it's okay. Don't blame yourself. She's always the one who's been looking after us, especially Laila. Especially after her heart scare years ago, she has never let us worry about her. And now it's your turn to take care of her. And I know that you're doing just that. So now we would like to talk about test results. I know this has been hard for you, but we will be here walking through everything gently with you. So, Doctor, so you know, right, that your sister had shown the same signs and symptoms 3 months ago, and now she's been admitted for the same. So we have done various neurological tests and MRI, and the MRI shows that she has carcinomatous meningitis. Okay, so I'll explain what that is. So carcinomatous meningitis is a type of cancer. It spreads around the membrane of your brain and spinal cord.
Cancer?
Yeah.
But we didn't know she had cancer. We thought it was just the after effects from the accident.
patient. Sometimes the cancer stays hidden or silent and it shows symptoms until it spreads.
She's been so forgetful and busy, she barely eats. It all makes sense now. It still have to be me. It's heartbreaking and we're very sorry you're having to face this.
Other symptoms like confusion, headache, and difficulty with balance all stem from this.
What's going to happen now? What does this mean for her?
We'll always be honest with you. On average, patients with this condition live around 3 to 6 months. Some do live longer with treatment, especially if symptoms respond early.
Our focus is on making her as comfortable and stable as possible and supporting her emotionally and physically through this. What kind of treatment can help her? Okay, so we can start with intrathecal chemotherapy. That's medication delivered directly into the spinal fluid. It helps slow the spread and relieve the symptoms.
We'll also use high-dose steroids to reduce inflammation and improve her clarity and condition. In some cases, palliative radiation might be considered.
Will it be expensive? Before we spend so much on the recovery after the accident.
I'm glad you brought it up. This treatment plan can be costly, especially over time. So do you know if your sister has health insurance?
She has a basic plan, nothing too comprehensive.
Well, that's a start. We'll have our financial team help review her coverage, and also we can apply for hospital-based support or charitable funding where available.
Okay, doctor, we will follow you through this process. Yes, we don't even have any option left. I don't know what will happen to my sister.
It's okay, we'll work with you to make sure that finances don't block access to medical treatment.
She eats very little lately. Everything tastes weird. She's always nauseous.
That's very common with this condition. We'll bring in dietitian to help digest her better, nourishing diet, easy to digest food, small frequent meals, and also protein-rich options that can make a big difference to her health.
Is there hope for her to live normally, even a little?
Normal may look different, but yes, she can have her good days back with symptom relief, therapy support, and comfort care. She can still find joy, connection, and peace.
We'll support her with physical therapy, home care coordination, and counseling. If she wishes to stay home, we'll include palliative and hospice care. My eye always said she values quality of life over length.
And we respect that completely. We'll build a plan that honors her values, one step at a time.
I thought I could be feeling down after this meeting, but it feels like we are not alone in this.
We are not, you have this, and we'll take every next step together.
Thank you, doctor.
Okay, so are you clear about your sister's condition?
Yes, doctor, we are clear about it, since you explained us.
Okay. So let's start today with symptom relief, a review of her insurance and a nutrition consultant. So I wanted to ask if you'll be able to deliver this news to your sister yourself, or do you want any help from our side?
I guess it's fine, doctor. We will deliver this news to our sister and support her emotionally.
Okay, then I think this will be end of our conversation. Thank you so much for coming here, and then
yes, thank you so much, doctor, for helping us too.
and if you need any more help or assistance, you can contact us. Feel free to contact us. Okay?
Okay, thank you so much.